Hello and welcome everyone to the Houlihan IQ 2022 Global Impact Summit. I'm Vernon Baxter and I'm the VP for Health at Houlihan IQ. As part of our Africa Summit this year, I'm delighted to be joined by Jason Carmichael, Founder and Chief Executive at Tibu Health. Welcome, Jason.
Hi, thanks Vernon, thanks for having me.
No problem. So today we're going to have a discussion about Tibu Health and hear from Jason about the business that he's building. But also we're going to talk with Jason about his views on the market more broadly across Africa and healthcare. And then we're going to finish by thinking a bit about what the market might look like as we take a kind of longer term view and take a long lens look at this market. But Jason, if we could start by hearing more about your business and kind of where it fits in the sector and tell us a bit of context. That would be a really helpful way to start.
Yeah, sure. Thanks. Thanks again for having me. Our business was born out of the need to connect individuals easier or more easily to healthcare services. The healthcare system in a lot of countries, not just the developing or low-income economies, also high-income economies. It's very fragmented and it's inefficient, and it takes quite a bit of time to get basic outpatient services. And so our initial hypothesis was, can we have this type of Uber for doctors thing, in the early days, and some of these assumptions were brutally crushed, as they say. But in fact, they were very helpful. They helped us evolve the model as to what the market is actually ready for and can absorb. But ultimately, what we do is we try to make it easy for people to seek basic outpatient services. We initially started by connecting doctors with patients on demand, and we quickly learned that it's more of a scheduling game, right? If you need to get connected to a doctor that quickly, you might not need care at home. You might need to go to the ER. And so it evolved into more, when would you like the services scheduled? Is it a vaccination at home? Is it a blood test that you want carried out at home? Is it a wellness check? Whatever it is, people typically have, weekends or evenings that they would like certain activities to take place. And so we started building the engine to, schedule services wherever people wanted them. So we position ourselves as healthcare wherever you live, work, and click, because, we really do provide them wherever it's convenient for people. And so that was in the earlier days, and that kind of evolved into building a platform that has multiple touch points, to go back to that ethos, wherever you live, work, and click. So incorporating virtual care, home-based care, and now we have a third touch point that's about to go live in the next about 8 to 10 weeks. So really, a simple version is, 300 plus services at people's fingertips that we can deliver wherever is most convenient for them. And on average, we save people about 5 hours by using our platform, as opposed to going to a traditional outpatient clinic.
Great. And Jason, it would be helpful also if you could maybe give some context in terms of the geographical reach of the business and the areas of focus, because obviously our summit series is global, and we're talking to businesses with different kind of digital health propositions and other propositions across all of these markets. So it would be really useful and interesting to sort of understand the degree of penetration or coverage for the business at this stage.
Sure. So, we're still very young, right? We're 2 years old. So we're currently focused on Nairobi, Kenya. Within the next year, we'll be transitioning to additional cities within Kenya. By 2024, we'll be starting to look at, or not looking at, actually penetrating different economies within East Africa, so Rwanda, Uganda. Then we'll be moving south to South Africa and west to economies like Nigeria and Ghana. I think there's a tremendous amount of room for growth for this type of business. I think adoption of these types of models will require more of an omni-channel model to service delivery rather than these silos, especially in Africa, where healthcare seeking behaviors are vastly different than those in the States or maybe higher income countries. And I think you need to leverage multiple touch points in order to really scale and to penetrate in a market, rather than give people just one access point, which is maybe virtual or what have you. Does that make sense?
Sure. Yeah. And in terms of your model as it is today and the model, how it might evolve as the business grows, I mean, would you characterize yourself as predominantly B2C in the way that you're configured and your route to market, or is there a partnership element as well?
Yeah, that's a great question. So I would say we're 60% B2B and probably 40% B2C. And so we work with a lot of insurers. We work with a lot of healthcare facilities to fill the gap. A lot of healthcare facilities are unable to deliver the services that their patients need. And they realize that it's not the best use of the physicians or the specialists' time. And so we swoop in, so to speak, and we come and fill that gap for our health partners. We also have a number of corporate partners that we engage on wellness exercises and chronic disease management exercises. We certainly see a shift in the corporate sector, where people are now associating, rightly so, that having a healthy workforce, is the right thing to do. But aside from being the right thing to do, it makes great business sense, right? I don't have to take 5 hours off to go get a very basic health check or to go get meds or what have you. Guys like us, we can get that done in less than 2 minutes. And so our average connecting time between a patient and a healthcare worker is less than 2 minutes. And so, to circle back, we have a B2B2C play more than just a B2C angle.
And just before we go into the kind of more wider context of the African health market and some of the innovation you're seeing from amongst your peers and other areas of the sector, just in terms of Tibu Health, and I suppose a question around price point and getting a feel for how you position a business like this and the convenience of healthcare at home versus the kind of traditional routes and ways of accessing healthcare. Are you able to kind of give a sense of how that dynamic works?
Yeah, so it's a good point. Many people will associate us as being tremendously expensive, right? You're doing it at home. The quality is very, very high. The spaces that we create, et cetera, it's very bespoke. People are usually surprised to see that we're very middle of the road, where our prices are usually cheaper than any outpatient clinic you're going to go to. The experience is far better, and the patient outcomes are also far better. I mean, when was the last time your physician called you after the fact that you saw him to see how you were doing 2-3 days later? It doesn't happen. We do that with our virtual care team systematically. It's just part of our operational procedures. And so the question then becomes, well, how are you able to, right? Because we're driven by tech, a lot of our processes are digitized. We don't have the big overheads that your traditional facilities would have, right? And so we're very lean, mean, and leveraging tech to kind of facilitate some of these processes, these follow-ups, these notifications, et cetera. And that allows us, to keep lean and to be able to deliver a better patient experience. So usually that's a surprise, and we still make money. I mean, we've broken even 3 times, and the margins are healthy. The margins are very positive. I think there's a little bit of abuse that goes on in the healthcare sector. And I think for too long, people have been focusing on how much money can I get out of this client, rather than playing the long game. Yes, we're in business, and yes, we certainly want to, stay afloat, but we are very much an experience company. If I give you a good experience and I follow up on you and the outcomes are good, I'm not just worrying about the today, I'm worrying about the future, right? And it makes good human sense, and it makes good business sense, right? And we haven't traditionally seen that in the healthcare space. Margins are already very, very healthy in the lab and different, pharma, et cetera. I mean, we need to stop focusing on just, how do I get more dollars out of this patient, and actually start thinking about the human experience and the patient experience. And that's something that we've traditionally done really, really well. And you can see by our Google reviews or our Net Promoter Score is 98. I mean, on the continent, the average Net Promoter Score for healthcare is -5, right?
Yeah. Yeah, and actually that would be a great opportunity to sort of broaden the conversation slightly, and obviously it's great to understand better Tibu Health's proposition, and we can come back to some elements of that. But you've obviously worked in different markets and different industries in your career. It'd be great just to get some thoughts from you in terms of where Africa healthcare is currently, and obviously some of the challenges, but also some of the areas where we're seeing progress and you're seeing innovation and you can kind of actually see improvement outcomes. I wonder if you could kind of give our global audience a sense of where that market is.
Yeah, so I think maybe if we start with the capacity question, so in my former life, I was with the World Health Organization for about 5 years, and I would often hear or be part of conversations where we need to graduate more medical students, or more nurses. We need to push more people through the system. We need to improve curriculums. And while that may be true, I think there was an important question that we weren't answering, or asking rather, which was one of retention. A lot of these countries, Kenya included, and there's data that the Ministry of Health themselves has published a few years ago, that there's upwards of 20 to 35% of healthcare workers that are either underemployed or unemployed. They're not working in their sector. That's not normal, right? Especially when you have doctor-patient ratios like we have. So for me, the fundamental question is, how do we retain, right? And the retention question among my peers in medicine is, I'm dropping out because I'm not paid on time. The salaries are not, I can't make a living and feed my family. The conditions are terrible. I know physicians that have to go out and, buy their own supplies, especially in these rural areas. And that's not fun, right? So I think for us, our healthcare workers, I think they're now 20 and above. The conditions are really good. The pay is above market. And people like working for us because there's tech and whatnot. But I think the conversation needs to change as to, this is the bedrock of any society, education, health. How do we keep people in their professions and not jumping ship to go do some animal husbandry or, whatever it is, right?
Yeah, so you kind of see those issues on the workforce pretty much at every level, because I think, in fact, it's probably a WHO statistic that, I think they predict by 2030, a fifth of all roles globally in healthcare will be vacant. But do you think there's particular, maybe kind of post-pandemic reevaluation of how difficult some of these roles are relative to compensation?
Compensation is definitely a good question to be asking. The cost of living is only increasing, but salaries are stagnating, right? So, I'm going to go do medicine and earn $2,000 a month, or I could go do business and I could do, 5 or 7, I think there's certainly some of that. We need to do a broad reevaluation of the conditions. And I think remuneration is part of those conditions, right? Like having physicians, on food stamps, for lack of a better word, or working multiple jobs just to make ends meet is not normal, right? I would jump ship.
Yeah. And so in terms of, we've talked a bit about some of the challenges in the market. How would you characterize, I suppose, some of the areas where you're seeing progress? And obviously you guys are part of, a community of other entrepreneurs and other sort of firms that are trying to bring innovation to the market and try and sort of address some of these challenges. I mean, do you get a sense that there's more momentum or kind of more focus currently?
Definitely. I think on a number of spheres. So one is how we're communicating health. I mean, we got into this, we were like the first players that were the wonky guys in the market communicating. If you look at our Instagram page or whatnot, a lot of it has now, kind of been replaced, but we, came to ourselves and said, we can communicate health in a much more engaging manner rather than medicalizing health that will engage people, have them take charge of their health, have them, call us and ask for advice. And since then, we see more and more of a shift towards that, engagement piece. How do we engage our patients? How do we stop looking at them as dollar signs? In terms of innovation, I think there's a lot more companies now that see this opportunity in health to say, okay, well, Let's talk about healthcare financing. Are there innovative models around healthcare financing? And that's something that we want to push into within the next year or so. Data management and records for facilities, right? I think there's a lot of innovation pouring into the health space, especially since the pandemic. I think health was always like the black sheep that was full of risk. And now we're saying, oh, actually, these are pretty weak systems. There's a lot of room to innovate. Let's start dumping money into this and actually see some real change. And I think the venture capital community is also starting to get on board, right? Like the population is going to double by 2050. There's opportunity there, like people are going to need healthcare services, banking services, education services. So I think we're definitely seeing more innovation. I think my concern is what happens to the public sector. Like a lot of what we're doing is their job.
Yeah.
Right?
Yeah, I'm interested on that point because, often Africa is cited as an example where digital has the potential to leapfrog existing kind of infrastructure or comparable infrastructure in kind of more developed healthcare economies. And, there's the positive side to that. And there's also a bit of a blurring of lines among sort of public and private and what is essential services and who's responsible for them and how are they funded. I mean, I'd be fascinated to hear your kind of view on, I suppose, those 2 points of, the potential for technology to, I suppose, circumvent or bypass some of those kind of issues of bricks and mortar and large systemic costs that you see in kind of Western healthcare systems. But secondly, as you alluded to, how does that leave the roles of state across these geographies?
Yeah, I mean, the state will always be relevant, right? I mean, in terms of setting up regulatory frameworks, compliance, I mean, a very, very important role to play. What I would like to see, and I'm sure this resonates with a number of people, is for there to be more implication and more working together with the public sector, right? I mean, we do work that they could benefit from, and if we were to work closely together, it can be very difficult to get into a partnership with the state, and for a number of reasons, very bureaucratic, very slow, whatever. There's a number of range of issues around that, but I think that's where you would really accelerate some of this change is with these strategic partnerships with government. But we tried in the past, and I mean, it was just so difficult and so lengthy that we said, you know what, let's just do it ourselves. And we did it ourselves, and almost 48 hours later, the product was live and we were delivering the services. The government has the benefit of having that authority, and I don't mean authority as in like, top down, but people trust the government.
Yeah.
They have access to populations, they have resources at their disposal, they have legitimacy. And so there's a lot of innovators in the healthcare space that could do some good in public hospitals, right? For service delivery, such as us, for chronic disease patients, for kids that needs vaccines, et cetera, that could benefit from a partner such as the government, and that could access much more people much more quickly and have a bigger impact if we were to partner with governments. I think one economy that seems to be kind of charting the way on this is Rwanda, right? They have a very business startup friendly ecosystem, and the people in government are very willing to have a seat with you, and how can we work together and how can we solve these problems, rather than having a more antagonistic look and competitive look to the relationship. I think that's how. I think we'll get there, but I think we're not quite there yet in a number of economies.
Yeah, and just to pick up that point that you raised about kind of partnerships and the potential for, I suppose the kind of best practice or the kind of, I suppose the application of technology to be harnessed across all of these kind of systems. I think if we were to take a kind of longer term view on the market, and maybe if you're looking at over time period of 10 years, 20 years, 30 years, I mean, what do you think are going to be the kind of fundamental drivers for healthcare across Africa? And, how optimistic are you that businesses like yourself, as you said, just starting out and it's, it's a long-term game, how much how radically different or more advanced could the system be?
Yeah. So I think the advantage that we have here is people seem to adopt new approaches much quicker. For example, home-based care or virtual care. The penetration hasn't gotten to the point where it is, for example, in the US, but there's an open arm type of approach to, oh, this is new, it can make my life easier. I mean, look at M-Pesa. I mean, we leapfrog a bunch of these old school methods. We leapfrog them in Africa completely, and I think there's going to be a bit of the same on the continent that's going to happen because people suffer when they go to public hospitals or any hospital, private or public. It's not fun, right? And so I think adoption of technology there's less of a barrier here once people try it once they see that it improves their lives. They're not going to go back to their old ways, right? And so I think in 10 years time we're going to see, I think the biggest, most radical change is a lot of this. We're going to have less people in brick and mortar, and we're going to have more people finding solutions online. And I think there's going to be a blended model between virtual and brick and mortar, where those will actually be interconnected, right? And in the truest form of the word, tied in by tech, versus now everything's fragmented. I mean, I want to get a referral or I want to get my patient records. You're getting ping ponged across the city 5-6 times. I think that'll be really driven by technology, and I think the most successful players are the ones that are going to blend those models well and have them in-house.
Yeah. And just on that point about I suppose, the interconnected nature of services and interoperability, all these sort of challenges that you see across pretty much every healthcare system. In Africa, do you think there's, by the very nature of a lot of these systems being quite nascent, do you subscribe to the view that there is the potential to kind of almost sort of skip past generations of complexity where you have siloed data that is very difficult to connect?
I'm losing you, Vernon. Do you subscribe to the view and then you broke off?
Yeah, I suppose just to shorten it, Jason, do you subscribe to the view that Africa has the potential to start with a clean sheet with a lot of these issues and has the potential to do it really well and do it once, as opposed to in the US or Europe, there's a lot of break-in and reconnecting systems?
Yeah, I mean, I don't think anybody's going to do it once and get it right the first time. I mean, we certainly didn't, and we're still learning. I think it's going to be a process, but I do think that the continent is extremely well positioned to develop some of these technologies and adopt them as well, and integrate them into their health system. Because maybe we're starting from a further point, right?
Yeah.
I was speaking to somebody a little while ago, and it's a very relevant comment, and I thought it was pertinent. But she said a lot of people often knock the continent for being backwards or whatever it is. But what we fail to realize is these are nations that are between 20 and 50 years old. You know what I mean? Like, these are new countries. How old is France? They've had centuries to figure this stuff out, and they still don't have it right. And so if you use that as your comparative, I think we're doing pretty good. And given how long it's been, and I think that we're probably going to be able to move faster than a lot of these other countries, as long as we involve the private sector. Don't regulate out the private sector. I mean, that would be a disastrous move. We're going to go backwards, right? Harness them, bring them in, work with them, build the partnerships. If they win, your populations win. I mean, there's nothing wrong with that, in my opinion, right?
Yeah. Well, look, Jason, obviously, as part of this series, we're talking to businesses from across the world of healthcare, and it's hugely fascinating for us to kind of get the insights from Tibu Health and your experience on the ground in Nairobi. I just want to finish by thanking you for your contribution to this summit and for taking the time to speak with us today.
Yeah, thank you for having me. It's a real pleasure. Thanks, Vernon.
Thank you.